as you can see, the pupil levels here is different, and the reason for that, they're able to look up, but here they can't, and the reason for this, they have something called an orbital floor. So usually the eye sits in here. These are the muscles that move the eye, and there's a muscle at the bottom there, and classically in children, they present without any redness if they had trauma to their orbit, and it's called a white blowout because it's white, but the muscle, the floor has blown out and the muscle is entrapped. This was missed, delayed presentation. The issue with this is the muscle here can die, leaving a permanent visual deficit, permanent double vision. And this was a litigation case. This was missed by more than one A&E, despite the CT scan. Nowadays, a lot of out-of-hours CT scans are reported from a peripheral source. It's not someone in hospital, and the reports tend to have a lot of variety in terms of quality. This gentleman here, unfortunately, was riding an e-scooter, which I learned seemed to go at a very fast pace, I think about 20 to 30 miles an hour apparently, and he suffered quite a bad break in the jaw. This was a sort of a personal injury claim because a car pulled out at him and he came off the e-scooter and landed on his jaw. This required complex reconstruction, several hours at theatre. So this has an implication to the sensation of the lip because the nerve was damaged, to overall continuity of the jaw, eating and drinking, and loss of a lot of teeth, which needed dental rehabilitation. So on this case, this involved a dental opinion, myself, a psychologist, and there was an opinion from an A doctor because he was trauma called in because of the speed of the injury and he'd lost consciousness. This is a personal injury case where this gentleman sustained a trauma to the cheekbone. This is the cheekbone here. This is the orbit, which you remember from this slide. The issue is here is they missed nerve damage in this area, and he presented several weeks later. There was an opportunity to repair this nerve so he can have sensation in this area, but this was missed. They fixed the bone, but they forgot about the nerve and the soft tissue. So again, an incomplete assessment.